If you are over 60 and your back hurts every time you stand up, walk, or try to exercise, this video is for you. If you've been told to just walk more, stretch more, or push through the pain, and it only made things worse, please stay with me. And if you're afraid that exercise will damage your back, your knees, or send you toward surgery, I want you to know something important right now. Relief is still possible, and it can be safe, gentle, doctor-approved, low impact, and easy to follow. No pain, no forcing, no walking required. Many people over 60 are dealing with daily back pain, stiffness, weakness, or a feeling like their back just can't support them anymore. And the truth is, most common exercise advice simply does not work for aging bodies. In fact, after 60, some of those exercises can quietly make back pain worse. Today, I'm going to show you a safer approach, one that supports your spine instead of stressing it, one that helps wake up the muscles that protect your back, and one you can do even if walking hurts. Let's start by understanding why this problem shows up so often after 60. As we get older, our bodies don't stop working, but they do change. The biggest change is not your bones. It's your muscles. Over time, especially if we sit more, move less, or avoid activity because of pain, certain muscles slowly go quiet. Think of them like light switches that are turned off for years. These muscles are supposed to support your spine, hips, and lower back every time you move. When those support muscles are inactive, your joints take over. Your spine takes more pressure. Your discs feel more load, and your nerves can become irritated. This is why back pain often feels worse when you stand, walk, or stay in one position too long. Your back is doing a job it was never meant to do alone. Another issue after 60 is stiffness. Joints become less lubricated when movement is painful or avoided, so people move less. And then stiffness increases. It becomes a cycle. Now here's something very important to understand. Pain does not mean weakness of character. And pain does not mean you failed to exercise enough. Pain often means your body no longer feels safe doing the movements you've been told to do. This is exactly why many popular exercises fail seniors. Walking is often recommended as the #1 solution for back pain. But for many people over 60, walking places repeated pressure through the spine, hips, knees, and feet. If your support muscles are weak, each step can gently compress the lower back again and again. Squats and lunges are another common recommendation. These movements require strong hips, good balance, and flexible knees. For seniors with stiffness or pain, they often overload the joints instead of helping them. Stretching can also be a problem. Aggressive stretching pulls on joints that no longer have strong muscle support. This can irritate nerves and make pain feel sharper. And balance-based exercises can be risky when confidence is low. Fear of falling causes tension. Tension increases pain. None of this means exercise is bad. It simply means the wrong exercises are being used at the wrong time. What we want instead are gentle, low-impact movements that turn the right muscles back on. Movements that reduce pressure instead of adding to it. Movements that feel safe. Before we begin, let me say this calmly and clearly. Move slowly. If anything causes sharp pain, stop. Mild effort is okay. Pain is not. And if you have a serious medical condition, always check with your doctor before starting something new. Now let's begin with the exercises. You do not need to walk. You do not need to stand if you don't feel safe. We will start seated. The first exercise is called seated pelvic support breathing. This exercise gently activates the deep muscles that support your lower back. These muscles act like a natural brace around your spine. This is safe for seniors because it is low impact, controlled, and done while seated. Sit on a sturdy chair with your feet flat on the floor. Sit tall but relaxed. Place one hand on your belly. Slowly breathe in through your nose. Feel your belly gently expand. Now breathe out through your mouth slowly, as if fogging a mirror. As you breathe out, gently tighten your lower stomach, like you are zipping up a jacket halfway. Do not strain. This should feel gentle. Breathe normally between each breath. Repeat this for 6 to 8 slow breaths. A common mistake is holding your breath or pushing too hard. This should never cause pain. If sitting is uncomfortable, this can also be done lying on your bed with your knees bent. Next is seated heel press activation. This exercise wakes up the muscles that connect your legs to your lower back. When these muscles work, your spine feels more supported. Sit tall in your chair. Place your heels on the floor slightly in front of you. Gently press your heels down into the floor as if you're trying to slide them back, but don't actually move them. You should feel light tension in your thighs and hips. Hold for 5 seconds. Breathe normally. Then relax. Repeat 6 times. This is safe because there is no movement through the joints, no pressure on the spine. Just gentle muscle activation. Avoid pushing too hard. This is not about strength. It's about connection. Now we move to a chair-supported hip hinge. This helps your body relearn how to move without stressing your back. Sit toward the front of your chair. Place your hands on your thighs. Slowly lean forward slightly from your hips, keeping your back long and relaxed. Only go as far as comfortable. Then gently return upright. Breathe out as you lean forward. Breathe in as you return. Do this 6 to 8 times. If you feel back pain, reduce the movement or stop. This exercise is safer than bending because your chair supports you and your movement is controlled. Now let's do a seated knee lift with support. This helps activate the lower abdominal muscles and hip muscles that protect the spine. Sit tall and hold the sides of your chair for balance. Slowly lift one foot just a few inches off the floor. Hold for 3 seconds. Lower it slowly. Alternate sides. Do 5 lifts per leg. Keep breathing. Move slowly. If lifting causes discomfort, simply slide the foot forward and back instead. Now we'll move to a bed or floor option for those who prefer it. This is called supported knee rocking. Lie on your back with knees bent and feet on the bed or floor. Place your arms at your sides. Slowly let both knees rock gently to one side, just a few inches, then back to center. Then the other side. This movement gently reduces stiffness and relaxes the lower back. Breathe calmly. Do 8 to 10 slow rocks. There should be no pain, only gentle movement. Now we'll do glute support activation. This is important because weak glute muscles force the lower back to work harder. Lie on your back with knees bent. Gently squeeze your buttocks together just slightly. Hold for 3 seconds. Relax. Repeat 8 times. Do not lift your hips. This is not a bridge. It is gentle and safe. If lying down is difficult, this can be done seated. Now let's talk about how to use this routine. You can do these exercises 4 to 6 days per week. The full routine takes about 15 to 20 minutes. Go at your own pace. After 7 days, many people notice less stiffness and more confidence moving. After 14 days, standing and walking often feel easier. After 30 days, many feel more stable, supported, and less fearful of movement. This is not about pushing. It is about consistency. If this video helped you feel safer about movement, I invite you to watch the next video where I show gentle standing exercises using a chair for support, designed specifically for seniors with back pain. Thank you for taking care of your body today.